Hi everyone! Today we will be talking about refugee healthcare in Canada. Some topics that we will cover are what refugees mean, what the Canada Health Act is, how health coverage for refugees has changed from previously being under the Harper government to currently being under the Trudeau government, and if these changes have coincided with the Canadian Health Act. Refugees are people who flee their home and/or country due to the following circumstances: war or violence, human rights violations, natural disaster, for example, floods or earthquakes, and other circumstances that disrupt public order. A refugee is different than an immigrant because immigrants choose to leave and refugees are forced to leave. A refugee is different from an immigrant in that an immigrant is a person who chooses to settle permanently in another country, whereas refugees are forced to settle in a different country. Canada resettles refugees to save lives and to provide stability to those fleeing persecution who have no hope of relief. Canada's resettlement programs are highly recognized because they provide permanent residence as a long-term solution. The Harper government made things a little more difficult for refugees coming into this country. Through the Harper administration, funding to the Interim Federal Health Program, or IFHP, was cut in 2012. This means 500,000 new Canadians were denied basic healthcare coverage due to their refugee or immigrant status. Some examples of basic healthcare services are physician and nursing care, inpatient and outpatient care, and lab and diagnostic services. Something that I want to point out with this is that the level of coverage that the refugees get is similar to what Canadians on social assistance get. They claimed they would be saving a pile of money, but it obviously came out at a much bigger cost. We all know that it is easier and cheaper to treat a patient when symptoms first manifest, rather than months down the road. Up until 2012, all refugees were getting the same basic coverage since 1957. This change had a huge impact on the lives of these individuals. Refugees located in British Columbia, Ontario, and Quebec were waiting 3 months for insurance eligibility. They were also being denied access to hospital services, prescription drug coverage, and physician and nursing care. Many of these refugees would delay seeing a healthcare professional because they simply couldn't afford it. Eventually, they would end up in the emergency room, and it would be an even more expensive task to access healthcare. Since Justin Trudeau has been elected, he has reinstated healthcare to refugees. He did this again through the Interim Federal Health Program. With the new Liberal government, the Interim Federal Health Program services were returned to the way it was before 2012. Supplemental coverage includes limited dental and vision care, home care and long-term care, services provided by allied healthcare practitioners including clinical psychologists, occupational therapists, speech-language therapists, and physiotherapists. Also assistive devices, medical supplies, and equipment including orthopedic and prosthetic equipment, mobility aids, hearing aids, diabetic supplies, incontinence supplies, and oxygen supplies. The government will be providing more upfront costs with this type of coverage, but in the long run, it will decrease emergency room visits and emergency situations, which will in turn decrease the amount of overall money spent. It is also beneficial to know that the Interim Federal Health Program does not cover services or products that a person may claim under a private insurance plan. The reinstatement of the Interim Federal Health Program improves the health outcomes of refugees while also protecting public health for all Canadians. This support from the government does not last forever. Typically, it continues for 1 year or until the refugee can become self-sufficient, for example, finding a job with some sort of health coverage. The impact that this has on refugees is that it allows refugees and new immigrants to have timely access to health care, basic health services to be insured, and medication costs to be covered. To be eligible for the Interim Federal Health Program, an individual must not be a Canadian citizen and must belong to one of the following groups: resettled refugees, such as the Syrian refugees, protected persons, refugee claimants, victims of human trafficking, or detainees. The Canada Health Act, or CHA, is Canada's federal legislation for publicly funded healthcare insurance. The Act sets out the primary objective of Canadian healthcare policy, which is to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health services without financial or other barriers. The Canada Health Act establishes criteria and conditions related to insured health services and extended health care services that the provinces and territories must fulfill to receive the full federal cash contribution under the Canadian Health Transfer. The aim of the Canada Health Act is to ensure that all eligible residents of Canada have reasonable access to insured health services on a prepaid basis, without direct charges at the point of service for the services provided. The 5 principles of the Canada Health Act are comprehensiveness, universality, portability, accessibility, and public administration. These 5 principles have been taught to us in previous classes, but if you're like me, a little refresher never hurts. Comprehensiveness means that all necessary health services, including hospitals, physicians, and surgical dentists, must be insured. Universality means all insured residents are entitled to the same level of health care. Portability means that a resident that moves to a different province or territory is still entitled to coverage from their home province during a minimum waiting period. This also applies to residents which leave the country. Accessibility means all insured persons have reasonable access to healthcare facilities. In addition, all physicians, hospitals, etc. must be provided reasonable compensation for the services that they provide. Public administration means all administration of provincial health insurance must be carried out by a public health authority on a non-profit basis. They also must be accountable to the province or territory, and their records and accounts are subject to audits. Even though the Canada Health Act strives to meet these 5 principles it sets out, there is still evidence of wide gaps in healthcare benefits from across the provinces. When looking at the Harper government and how they handled the Interim Federal Health Program, it is plain to see that the requirements of the Canada Health Act were not being met. These changes violated Section 15 of the Charter, which deals with equality. Section 15 of the Charter of Rights and Freedoms states that every individual is equal before and under the law and has the right to equal protection and equal benefit of the law without discrimination. The Harper government failed to realize that by cutting funding to the Interim Federal Health Program, it placed the lives of these marginalized group of people, the refugees, at a huge health risk. Changes made by the Trudeau government to the Interim Federal Health Project do coincide with the Canadian values and underpinnings of the Canada Health Act. By restoring the Interim Federal Health Program back to what it was prior to 2012, it has allowed refugees to access the healthcare system in a timely manner. Timely access does not necessarily mean fast or immediate access to health services. Instead, it means that services are being provided consistently with clinical practice guidelines, which ensures that a patient's health is not negatively affected while waiting for care. That's all for our presentation this week. We hope you enjoyed it. Now I just have a few pages of references that we used to make up this presentation. Thanks for watching.